So next up is managing the experience. Another difficult thing to measure is stress and the management of stress. Speaking about soft skills like compassion and confidence, it's really hard to come off as compassionate and confident if you're stressed. So we identified this as an issue with the business in partnership. They said we really need to help our call center representatives understand how to manage stress, not only within themselves, but with the members calling in. We're a health insurance company. The things that people are calling in and talking about and dealing with when they have to deal with a health insurance company, they can be really intense. They can be innocuous and not that big a deal, or they can be that you're pregnant or a loved one has been diagnosed with cancer. These are the times when you're calling us, and we need to be able to show up to those really stressful conversations. There were a couple of flags that occurred in the call center that we really saw some reps struggling with this. And so we wanted to give them a learning experience that would give them practical tools for handling stress, not only in themselves, but also in the member. And it's important to be able to deal with it in both yourself and in the conversation when you're a rep. So in the summer of 2020, we launched the Managing the Experience initiative, and this is what happened. We had the participants, before we did the ILT, they filled out a confidence survey. We didn't ask them specifically, like, how do you handle stress, right? We said, how confident are you? We felt that this was going to be a little closer to the metric that we were going for, because really at the end of the day with soft skills, and with the tool that we're using, it's really how comfortable are you behaving in X way or doing X. So we had them complete a confidence survey both before and after, and we wanted to show, how comfortable the agents felt with the new skills that they were being taught throughout the class. Because remember, we're giving them practical tools to use and practical ways to handle stressful calls. We wanted to see how confident they were before being handed the tools and then after. Our findings are really cool. So with each of the 3 bullets you see on screen, they really represent 3 levels of data. The highest level, overall confidence, increased by 23%. The blue bars are aggregate scores within the activity container with all the questions. So that's kind of the highest level there. The next metric, I really love it, and it's 1 level down from the overall. So the number of reps who reported their ability to reset after a difficult call increased by 36%. All the confidence questions tagged to the ability to reset after a difficult call, which is probably the most practical of all the sets of tools that we gave them. That number is much higher than the overall confidence, which is so remarkable. And putting myself in the position of an agent, I want to be able to go into my next call fresh and measured, rather than carrying forward the stress that I feel from that previous call into my next interaction with the next member. That was a really big deal for us. I want to point out something before I get to the last bullet that you see on screen here. The slide that we saw before with the M-level metrics, thinking back to that slide, remembering those were individual questions. What you're seeing here with the blue bars is the percentages before and after. The after, because it's listed by higher percentages, is higher up. So we were able to see right away as the data was coming in how much the overall confidence was increasing across all participants. We had that individual question view, but this is 1 level higher up and averages all of those question responses, which really gives us interesting data on overall impact. Rather than seeing trends at an individual question level, we were able to look at trends as a whole. Secondly, as a reminder, this is different because we weren't really measuring knowledge. We were analyzing confidence in areas associated with behavior and soft skills, etc. Okay, that last bullet point. The area of lowest confidence post-training was in response to this question. How confident are you to handle a call in which the member threatens to harm himself, herself, or others? 62% were still not confident after we gave them the skills and tools to handle these types of calls. There was still 1 type of call that was problematic. Only a little over half the respondents felt confident in handling this. So we had this little nugget here to work with, and I'd like to share with you what we did based on some of the findings that we found, particularly around that. While our actions focus on that 3rd bullet from the previous slide, the first 2 bullets are important because they really help build a case that the training had a positive impact for learners. So Similar to the previous example, we identified those 3 key areas, but unlike champions, since these were soft skills, the follow-up actions were a little bit more hands-on. The designer created supplemental post-training support material and made it available on a separate content area called the microlearning library. We highlighted and featured content that spoke directly to the opportunity areas. So rather than going back into the curriculum and editing, we created post-training support because particularly with something like stress, you really need those consistent reinforcements to keep that fresh and to keep it strong. The trainers analyzed the opportunity areas and placed more emphasis in class on those key areas. The business leadership reviewed and updated knowledge management process documents related to members who threaten to harm themselves or others so that reps could have a clearer direction on how to handle these types of calls. You shouldn't have to guess when you're navigating a really difficult call like that. You should have very clear procedure to follow, and that's what we adjusted. The knowledge gap really demanded, or the confidence gap really demanded a process to detail step by step the correct and proper actions rather than tips in a curriculum.
That's interesting. Thank you. So we're going to do another poll question.